Hello everyone, welcome to this topic on the anatomy of the bony pelvis. This content is based on Beckmann and Ling's Obstetrics and Gynecology. And this is chapter 4, and in this session we will explain the structure, regions, measurements and the obstetric significance of the bony pelvis. Let's get started. The bony pelvis forms the structural foundation of the pelvis and consists of three major components: the paired innominate bones and the sacrum. The innominate bones join at the symphysis pubis anteriorly and articulate with the sacrum through the sacroiliac joints posteriorly. The sacrum, which is made up of 5 or 6 fused vertebrae, connects inferiorly to the coccyx and superiorly to the fifth lumbar vertebra. Together, these structures create a strong yet flexible base that supports the weight of the body and accommodates the demands of pregnancy and childbirth. The pelvis is divided into two distinct regions: the greater pelvis, which is known as the false pelvis, and the lesser pelvis, referred to as the true pelvis. The greater pelvis serves as a supportive structure distributing the weight of the abdominal organs and supporting the uterus during late pregnancy. It is bordered by the lumbar vertebra at the back, the iliac fossa on the sides, and the abdominal wall in front. On the other hand, the lesser pelvis houses important pelvic organs, including the uterus, vagina, bladder, ovaries, fallopian tubes, and the parts of the rectum and anus. This region is enclosed by the sacrum and coccyx posteriorly and the ischium and pubis on the sides and front. Understanding pelvic anatomy is crucial in obstetrics because the size and shape of the pelvis determine its capacity for vaginal delivery. This is evaluated through a process which is called pelvimetry, where the diameters of the pelvic outlet, pelvic inlet, and the mid-pelvis are measured. These measurements can be estimated clinically during a bimanual pelvic exam or more precisely with radiographic imaging such as X-rays or CT scans. Pelvic measurements are essential for assessing whether the pelvis can accommodate the fetal head during vaginal delivery. One of the most critical measurements is the obstetrics conjugate, which represents the narrowest fixed distance the fetal head must pass through. Other important measurements include the interspinous diameter, which is the distance between the ischial spines, and the transverse diameter, which is the widest distance at the superior pelvic aperture. These dimensions help identify any potential issues that may arise during delivery. The obstetric conjugate is measured indirectly by assessing the diagonal conjugate, which is the distance between the lower border of the pubis and the lower sacrum at the level of the ischial spines. The obstetric conjugate is typically 1.5 to 2 centimeters shorter than the diagonal conjugate. To safely accommodate a normal-sized fetal head, the obstetric conjugate should measure at least 11 centimeters. This measurement is critical in predicting whether vaginal delivery is feasible or not. The Caldwell-Molley classification system categorizes the female pelvis into four basic types: gynecoid, anthropoid, android, and palatoploid. The gynecoid pelvis is the most common, seen in 40 to 50% of women, and is ideal for childbirth due to its cylindrical shape and adequate space. The anthropoid pelvis, it occurs in about 25% of women, is elongated in shape. The android pelvis, found in roughly 20%, resembles a male pelvis and can be less favorable for vaginal delivery. Finally, the platypoid pelvis is the least common and present in only 2 to 5% of women, and is characterized by a flattened shape.